Wait, no, that's not it. It's this room. Oh, hey. Who's this? This is a 29-year-old man brought to the emergency room semi-conscious. According to paramedics, he was non-responsive to their presence. He just ignored us. Okay, well, that's not very helpful. Let's see. We're just going to...
Ouch.
Pretty normal. There we go. I guess I got to go way over there. Normal reflexes. Thank you. Let's see. Normal legs. Just stick that leg out, girl. That's right. Normal legs. Bet you it's cocaine this time. This guy looks like he does cocaine.
Oog.
He might have been smoking on one of them jazz cigarettes, which is marijuana, I do believe. Wow, he is dilated. Yeah, I bet you that's not seeing it, huh? Okay, can you say Alice? Alice. Ooh, I like how his eyes stop dilating for the animation. Let's see.
Ouch.
Yeah. Ouch. I would like to. I'm going to. Do I even need to do an angiogram? Because that's like an overutilization of laboratory services. All right. What do we got? Is it cocaine? But few, if any, other abnormalities. CT scan, MRI, and angiogram, skull X-rays are all normal. Okay, well, I'm gonna prescribe cocaine. What's the treatment for cocaine usage in the 80s? Is it just more cocaine? Because everybody's doing cocaine. Fine. You know what? Let's do an MRI. I bet it'll be normal. Yep, looking normal. Let's do a CAT scan. Looking normal. Skull X-ray. Looking normal. Angiogram. Looking, I guess, normal. And then I would like to prescribe treatment. Aspirin, physical therapy. Exercise the extremity, prescribe physical therapy, refer to a psychiatrist, prescribe codeine. I think it's aspirin. What am I supposed to do to a cocaine person? I'll give him codeine. No, don't give him codeine. What? People in the 80s are like, I'll give him more drugs. You should always perform a full physical examination. Patients addicted to cocaine will normally show no symptoms except for abnormally dilated pupils. All other readings. Cocaine addicts should be referred to the psychiatric treatment since there are no neurological abnormalities. Oh, that's reasonable. Like, the guy just does cocaine sometimes. What's the problem? All right, let's go to room 3. Hey, lady, what's up? Patient, a 38-year-old woman admitted to semi-conscious. According to friends, she was non-responsive to their presence. Recently received a pacemaker. I'm not going to fall for this again. Before I do any of that, girl, you're going to the CAT scan. Normal. You're getting a skull X-ray. Yeah, it looks pretty normal. I like how it looks like a skeleton wearing a helmet. An angiogram. Alright, looks the same. Well, I can't prescribe treatment yet, so let's see here. What do we got? We got the follow the light. Pretty normal. Okay. And let's see this thing. Normal looking. Alright. Yeah, okay. Probably shouldn't make fun of somebody who's clearly had a stroke. Alright, what do we got here? Alright, I'm gonna do it this time. That worked. Uh-oh.
Ouch.
No pain, girl. What's going on with that right side? Normal strength. Ooh. Interesting. Oog. Okay. Well, let's take a look at the results of our physical examination. Weakness? How do I test for weakness in the arms? Or just click around with my hands? Like, what do I do here? Yeah, weakness in the left. Okay, how do I... What am I, like, supposed to click on for this? It just does it. Alright, so what do we got here? We got no pain detection in the left side of the face, weakness on the left side, aggravated reflexes in the left leg, weakness in the left leg, and no pain. Something brain is happening, but there weren't any abnormalities. What am I supposed to do? Is this hysteria? This commonly occurs in women. And a sensory defect may be present. This commonly occurs in women. I do not, do not give me hysteria here. Some patients have pain due to simple headaches. Let's see. Hematoma. Subject to a collection. I didn't see anything weird. Infarction. Occlusion. I don't know how to detect occlusion. So what's a normal? That's normal. I don't know. Aneurysm. Aneurysms are abnormal dilations of blood vessels. Well, let's look again. I want to look again at the angiogram. Yeah, it looks pretty normal, I guess. I don't know. It's like a 5 pixel image here. Let's prescribe. I'm not gonna fall for this again. Uh, refer to the psychiatrist. Oh, buddy! Oh, upon recovering from a migraine headache, your patient has sued you for malpractice. Perhaps you need to spend some time in med school. Fuck you, buddy. Uh-oh. Do I just exit? I'm going to class now. Migraine headaches can show many of the symptoms of more serious conditions. Weakness, slurred speech. Wait, slurred speech can occur with migraines? That's terrifying. The best way to distinguish migraine is from a serious brain lesion is by performing a CAT or MRI, which would show no abnormalities. I saw no abnormalities, and I'm like, all in your head, girl. Go to the psychiatrist. Get yourself some therapy. It's the 80s, so everything's really cheap. In America in the 80s, the boomers thought healthcare was going to stay cheap forever. Little did they know Reagan was already destroying what they had. Anyway, the only effective treatment we have for migraine sufferers is a strong painkiller such as codeine. Oh, okay. Oh, what? Patient in room 2. Oh, this is the same guy. He got older, though. Patient, 57-year-old man who came to the hospital unable to use his left hand. According to his friends, they found him on the floor unable to move. Well, we're going to give him an MRI. Normal. CAT scan. Normal. Skull x-ray. Normal. Angiopathy. Normal. So all normal. I bet it's a migraine. Oog.
Oog.
I got an oog. There. No, there we go. Sorry, buddy. I gotta grab your hands for some reason. What am I supposed to do here? I don't understand. Whatever, what do we got? We got normal, but there's weakness in the left arm. Alright. Oog. Can you follow this thing I'm holding? We have a special neurology thing. Alright, let's check out the light. Normal. Say Alice.
Alice.
Alice! Nope.
Ouch.
Ouch. I bet this guy has hysteria. Alright, let's check. Your leg strength's pretty good. Leg strength's pretty good.
Oog.
Nothing on the right side. Alright. Well, let's go to neurology. Similar reflexes can be aggravated. Also speed. No, so we don't have that. It's not an infarction. Hysteria. A sensory defect may also be present. You know what? I'm going to blame hysteria. I would like to prescribe treatment. Refer to a psychiatrist. Terrific. The patient was suffering from hysterical paralysis, a disease that doesn't exist. Hey, at least it was also a dude. Good job. Oh no, I have a patient in room 1. Hey, buddy, doing more cocaine these days? Oh, it's a different guy. I didn't even look at your history. I don't need to look at your history. I'm that good of a doctor. Oh shit. Pupils are hyper contracted.
Alice. Ouch. Ouch.
Ouch, ouch. All right, what else we got? Oh, this is to pull it up and push it down. Pull it up, push it down. Yeah, do the milkman or whatever they call that. I don't know what that's called.
Ouch. Ouch.
Pretty normal. I bet you this guy's doing drugs. Normal leg, normal leg, normal reflexes.
Oog. Oog.
Oog. I don't know, dude. Your pupils are all kinds of fucked up. Cocaine, not dilated pupils. What about morphine? Narrowed, non-reactive pupils. A CAT scan, MRI, and all those things would be normal. Well, I think we could get away with this. How do we treat morphine? I'm going to suggest that you go to a psychiatrist. As a morphine addict, your patient might not have survived without counseling. Oh, thank you. At least they're treating it with counseling instead of like, give him some codeine. Oh, but I don't want to go to class. You should read the patient's history. Often provide you with... Oh, did I never even look at the history? Easy. Patient 4. Hey, girl. Patient, a 21-year-old woman with a severe headache. According to family, she's in severe pain. Well, let's do an MRI. Normal MRI. Let's do a CAT scan. Normal CAT scan. Let's do a skull x-ray. Man, you're going to be paying for this for like 30 years. All right. Let's do an angiogram. That's pretty normal to me. I bet you just got a headache. Can you say Alice? I'm going to get sued for malpractice again. Normal pupils.
Ouch.
Nothing on that? Nothing on that side, huh? Okay, so let's see. We got normal arm strength. Normal arm strength. Oopsie. Whoopsie. Normal reflex. Normal reflex.
Ouch.
Nothing on that side. It's the right side, I think. Let's see. We got normal leg. Normal leg. This is me as a doctor. Oh, that's some hyper reflexes there, girl.
Ouch.
Ouch. All right. This is looking like your classic case of migraine. There's several types of migraines, cause weakness in the arm and leg on one side. Can be aggravated. CAT scan and everything else is going to be normal. Okay, so that's a migraine headache. I'm not going to get tricked like I did last time. I'm going to prescribe you. I'm going to prescribe you some codeine. Prescribing a strong pain reliever. Is codeine a pain reliever? I would. It's a analgesic, but it's not going to get rid of the problem. It's just going to make you not care as much about it. I guess it's a pain reliever. There's probably better ones. All right, is a patient room 4. They had fentanyl at this point. Why aren't they prescribing that? All right. Oh, I should look at the history. Yeah. Semi-conscious, non-responsive, whatever. Don't care. Look. Oh, girl, are you doing cocaine? You doing cocaine? Yeah, I bet you're doing a lot of cocaine these days. You know, it's the 80s. Alice.
Ooh, ouch.
Oog, ouch. I gotta do the whole physical exam. Hold up. She was non-responsive. She just kept snorting cocaine while the whole time we were there. I said, "Hey, Grandma, don't you want to go outside and have fun?" Ooh, reduced reflexes. What? Or is those normal reflexes? Ah, they're normal. Darn it.
Ouch. Ouch.
Girl, you gotta stop doing so much cocaine. You know, we all been there. We all want to not get poked with a needle by a med student. Yet here we are. Girl, I'm gonna prescribe. Well, I should probably do an MRI. Yeah, okay, it's normal. I'm gonna prescribe treatment. You're crazy, and you need to go to a psychiatrist. Cocaine addiction. Oh man, I gotta go to class. Uh-oh. I read the history. I did it already. I don't need to go to class. I have patient room 2. Well, I'm gonna ignore that. I want to go in here. We got one in the morgue. Patient was suffering from a migraine. Oh! Patient was suffering from a migraine headache, cause of death, heart stoppage due to pacemaker failure when exposed to a large magnetic field. Oof. Oofa doofa. Nothing going on in here. All right. Well, what's in here? I'm just going to want to go in here. This is an angiography lab. This is a place where angiogram is produced. Okay. Give me some more. Is used to detect diseases that alter appearance of blood vessels. Contrast dye is injected. Digital subtraction. Yeah, I know all this. Digital subtraction angiography uses computer techniques to remove, subtract unwanted background information. Angiograms are particularly useful in diagnosing aneurysms because they show the location and extent of the dilated blood vessels. The following slide. Oh, this is how I need to know. This is a normal. That is an abnormal. That's an aneurysm. Subdural hematoma. And that's a clot, or that's an infarction. Note the blood vessels have been pushed out of the way. All right. You have a patient in room 2. All right, what do we got here? I'm just going to poke you with this. Ouch, oog. Almost all my patients have been boring. All right, well, that's exciting. I feel like I've trained hard enough. It's time to up the difficulty. Here, after this patient.
Ouch. Alice.
Alice. Ouch, ouch, Alice. Ooh-doo-doo-doo-doo. This is a neurological hospital where everyone just has a fucking headache. And yet I still managed to kill somebody. Alright, whap. Normal. No. Is that normal? I don't know. The all-knowing computer will tell me.
Oog. Oog.
Oog, oog. Alright, well, have I finished my complete exam? I don't think so. It's normal, normal. What do we got? Alright, so everything's pretty normal except you've got weakness in your left arm. I don't know. Stop playing so much tennis. Found her on the floor unable to move. Otherwise normal. Let's do an MRI scan. That's pretty normal to me. Let's do a CAT scan. It's pretty normal. Let's do a skull x-ray. That's pretty normal. Let's do an angiogram. That's pretty normal. All right. I would prescribe treatment. Exercise the extremity. Patient is improving nicely with the aid of physical therapist. All right. No, I don't want to. I want to go to my office. I'm going to look at my computer. And I'm going to do advanced mode. What is nightmare mode? I don't know what that is. Let's just turn that on. All right. Let's exit that. Report to class immediately. Before examining a patient, you should read the patient's history. Class is over. See you next time. Oh, first I got to go in the OR. I got to learn about different procedures. You're now in what we call the operating room, or OR. This is where all of our surgical procedures are performed. All right, more. Therefore, it is kept meticulously clean. This room is designed to reduce the risk of bacteria infecting open surgical wounds. Also, they didn't know about prion diseases at this point. Our ventilation system occasionally pumps fresh filtered air. The walls and floors are scrubbed at least once a day. Good. Probably should do it more. Before surgery, all the neurosurgeon's sterile instruments are covered with towels. What? And arranged on wheeled tables and trays. You're watching neurosurgery team in action. When it's time to offer you, will you be ready to take the knife? No. I don't know. I have a patient in room 4. Hey, friendo. 58-year-old man is semi-conscious, non-responsive to their present, recently received a pacemaker. Uh-oh. Let's look at the angiogram. Oh, it's normal. Skull x-ray. Normal. CAT scan. That's pretty normal. I bet you just have normal face. You gonna look at this? Your pupils are dilated, buddy. Buddy, hello. Hey, you doing cocaine these days?
Oog.
Oog. I want to be one of these DOSBOX voice actors. That would have been fun. Just be like, oog. That's like a sample. That's like a PCM sample. Slap your face around. You say Alice.
Ouch. Oog.
Ouch, oog. All right, well, I'm pretty sure it's cocaine. Yeah, it's pretty normal. Bet you that.
Oog. Oog.
Oog. Sorry, bud, you got cocaine. It's time to go to a psychiatrist. Good job. I have a patient in room 3. What's going on with you? Say Alice.
Alice.
Okay.
Ooh.
Nothing on that side. Yeah, come on. Oh, I gotta load the animations. All right. Normal. This is really sad. I want a case. Give me a case that's like hard. What's your history anyway? Who came to the hospital unable to walk. According to friends, they found her on the floor unable to move, allergic to crab and other shellfish. What? How is that relevant? What, did she get like a Vibrio infection and now she's like dying? Normal reflexes. Normal.
Ooh.
Nothing on. Still completely paralyzed down that side. Normal strength. That's like hyper strong. There's a difference there. Oog.
Ouch.
Ouch. Alright, so we got here weakness in the right side. Weakness in the right side. No pain on the right side. Interesting. Interesting. Well, you know, we'll just oh wait, did you have a pacemaker? I can't remember. Ah, you don't have a pacemaker. Into the MRI you go. That's pretty normal. What? Code red at the CAT scanner. Well, what's that got to do with nothing? What? Oh, is there like blood in there? Is there like horseshoe crab blood in there? Oh no. I can't remember if they have horseshoe crab blood. Is the contrast dye. We'll talk about this in med school. Report there immediately. Oh, I don't want to go to med school. You should read the history. Some patients are allergic to iodine, which is used as a contrast. How is you can't have an iodine allergy? Oh no, that's like an element. That's like a critical element. You sure it's the iodine or not some component that's like in the dye that is often associated with the iodine or like the iodine refining process. Anyway, use MRI instead of allergic reactions. See you now. Did I kill the patient? Wait. Did I kill the patient? I fucking killed the patient. Oh no. Oh, I'm a murderer. Am I in nightmare mode? Nightmare mode is active and I've got an advanced level. Okay. I've got a degree in neurology and I'm going to use it. Hey, a 20-year-old woman admitted semi-conscious. They found her on the floor, unable to move, allergic to crab and other shellfish. Well, then you can't do the CAT scan. Let's just look at that brain. Oh, honey, there's something wrong with your brain. Oh shit, fuck. That's not a normal brain. Ah. Oh god. Fuck. Oh no. Oh, that's not good. Let's do a skull x-ray. That's pretty normal. Let's do an angiogram. That's normal too. That's a very abnormal MRI. It's just whoop whoop. Those are all working. Let's see. That's fine. That's girl. You okay? I got
Ouch.
nothing on the left side. All right. Well, let's just see. Oop. Oh, that's a brain injury right there. I got one eye. That's a stroke. Uh-oh. That's no good. It's unresponsive. Say Alice.
Alice.
Weird.
Ooh.
Yeah, I gotta say, you got something going on in your brain pan. No, it's not working out. Uh, I don't know. As I'm underqualified. The only training I've received was a DOS game. This is a sec, girl. I gotta go consult with the MRI department. It's a CAT scanner. Well, I don't need to know about that. Where's the MRI? I thought there was an MRI machine. Is that the OR? That's that. Was that the MRI? No. Is that the MRI? That's the angiography. That's the radiology lab. What's that? Is that the MRI? Yeah, it's the MRI. This is the. I always thought it was the magic resonance imaging scanner. More, please. The images produced by MRI scans do not employ use of X-rays or other radiation. And no, they use radio waves, dude. They're just not X-rays. They're like low intense. They're not ionizing radiation, but it's like light. It's not using light. It's using a much lower light wavelength than that. But come on. All right. Similar CAT scans, MRI scans usually give greater contrast. During imaging, the patient lies inside the massive hollow cylindrical magnet is exposed to a powerful magnetic field. The portions of the body's the protons of the body's hydrogen atoms then line up in parallel as opposed to normal random arrangement. When they are knocked out of alignment by a pulse of radio waves, they return to detectable signal as they fall back into place. The computer interprets the varying signals return. It's basically a map of the water in your body. Very good with the soft tissues. That's a normal. That's an aneurysm. That's a subdermal hematoma. This patient is an infarction. Oh dear. Yeah, that's what a stroke is. This patient is a brain tumor. All right, well, let's go back to my patient, which is in room 1. Girl, pretty sure that you have an infarction. How do you treat an infarction? Infarction occurs when a blood vessel that supplies the brain becomes blocked, often by a small blood clot. Because the resultant loss of blood supply, a portion of the brain supplied by blood vessel dies. This results in weakness and loss of sensation of the body on the opposite side. Pupil dilation and light reaction and eye movement will also be affected on the opposite side. If the infarction is on the left side, speech will be slurred, and the CAT scan and MRI show a damaged area of the brain. Angiopathy often reveals occlusion. Skull x-rays are normal. Didn't reveal occlusion this time, but that's good. I don't know how to treat for infarction. Prescribe treatment. Prescribe aspirin. Oh fuck! What am I supposed to do for that? How do you treat an infarction? What am I supposed to do? Occurs when a blood vessel supply that become often by blood clot. Similar to those in brain tumors, weakness and loss of sensation, blah, 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 blah. All right, speech impairment will be experienced. The best way to identify an infarction was a CAT or MRI scan. The only effective treatment is physical therapy, which may restore much of the patient's abilities lost through the death of brain cells. Oh! Oh! Aren't there? Oh dear. Oh God. Well, the good news is that sucks. I'm gonna